Hello, good afternoon, good evening, good morning, and welcome. It's Nurse Richard, the Wax Wizard. Thanks for joining me for this. Really, you might guess by the title of this one, by the way, quite a serious one, and an incredibly difficult procedure. It is one of the longer ones, which I know a lot of you like. Watching me have a bit of a battle. It's about 17, nearly 18 minutes long. Now, I did start with this. I'll tell you a bit more about the patient in a minute. I did start with the curette. Now, this is one of Neil's curettes, which it's double-ended. Everyone likes a double-ended tool, don't they? And ladies, you know what I'm talking about. Sorry. My mind went there. It probably shouldn't have done. But I stopped that because she found it was quite ticklish and found it quite... It wasn't uncomfortable. She just felt it was really ticklish as it was obviously approaching and touching up against the side of her ear, which this is all on the outer part of the ear, so it wouldn't have been painful. But as you can see, the suction's done its job there. It's pulled out that lump there, but have a look at what's behind this. As soon as I saw that, I thought, oh, this is some serious issues going on here. And the serious issues could be one of a myriad, word of the day. It could be one of a myriad of things. When I first saw it, I'll be honest, I thought fungal, because of all these white spots everywhere, and it's quite sloppy, quite slimy. And again, I know we've called it like ear soup before. So I thought there's been some. I mean, there still might well be some fungal involvement here, but as we get to delve into this a bit more, I started to find a lot of craters in both ears, which what that tells us, I'm not entirely sure. We'll try and get into that a bit later. But the more I delved into it, the more I thought, all those white bits there, could they actually be just flakes of bone that have just disintegrated away from this ear canal? Because it's pretty much, it's disintegrating this ear canal. It's a right mess, the poor lady. She wasn't in any pain with this. We get asked on lots of videos. What symptoms the patients have. The only symptom she had was she couldn't hear. Now we've fixed that. But she didn't have any pain at all. Most people don't, to be honest with you. Very extreme cases of really nasty infections or keratosis cases, that's quite typically comes with audiology, which is the fancy word for pain. But no, this lady didn't have any at all. But you will see there's large areas of exposed bone in this, and I suspect that it's could well be circulation related, because she did have quite a lot of health issues, this lady, from what I remember. She wasn't hugely elderly. I don't want to say, I think she was in her 70s. And she did have vascular dementia, unfortunately. It didn't affect her as much as some, but she obviously did have some memory issues and some awareness issues, which kind of made some of this procedure difficult, because we kept needing to stop the procedure and clearly explain what's going on if she was a bit confused, if not quite sure what's happening, or what she's seeing in front of her, what I'm doing, what the strange noises are. So we had to take our time. You obviously won't see all that in the video, but there's quite a lot of explaining and reassuring that had to go into a procedure like this. And it was at this point that I realised it was crumbling, this ear, because that yellow part on the side there, just underneath the pink skin, that's bone. Bone's often off-white, like this, kind of a yellowish appearance. And you don't need to put something like this under a microscope, because you can feel it. As soon as the end of your suction probe touches it, you can just feel it scraping against it. She didn't feel it. People very rarely do. But that's when I knew that something was quite wrong with these ears, and just as much in the other ear as well, unfortunately. So what does that tell us now? Could be a few things. It could be that there's a combination of things is probably more likely. I think that certainly is and probably has been an underlying infection in here. But I think there is, because when she's got known vascular issues, that's a type of dementia that she's got, where the blood vessels don't work as well. They might be narrowed, and then obviously you don't get as much oxygen to certain parts of the body. In the case of dementia, you don't get enough oxygen to the brain, and that can lead you to feeling confused in some way, maybe not functioning as mentally well as you used to. And some of those vascular issues could have applied to her ear as well, where it just wasn't getting a good enough blood supply, and to the point where it just starts crumbling away. She could have also had could have been born with like a really bumpy ear canal. Some people that does happen, where it's not necessarily even, and then the epithelial migration can be affected by that. If they don't understand what the epithelial migration is, that's the process of skin shedding itself out the ear, in layman's terms. And if you've got a few bumps and bends, and sometimes this skin can just start collecting in those, and then more skin comes, collects in it, then it buries in. Could have been that. You never really know. A lot of, as I've said before, a lot of medicine and healthcare, unless it's something obvious that can be diagnosed with a test, or an X-ray, or a blood test, or a CT scan, or an MRI scan, a lot of it is informed and educated guesswork, thinking what's most likely with what you're seeing and what someone's explaining to you. So we'll never 100% know the cause of all these. Obviously, she has been referred to the specialist to see what's going on here and what they can do about it. Considering all her other health conditions she's got going on, I'm not 100% sure what they would do. That they would have to weigh up what are the benefits of doing something versus what are the risks of doing something. If someone's at risk of complications following surgery, they might think against it to manage things, what they call conservatively, which is kind of a watch and wait and monitor. I've certainly asked them to treat a probable underlying infection in here. I was having real difficulty at this point getting to the top part of her ear. It wasn't the biggest entrance to get into, and it's always the trickiest part to get into, the top part. And you can just see at the top right hand there is some slight bleeding there, where the edge of the tube is only just mildly touching up against the side of the wall, and it didn't take much at all for it to just cause a little bit of friction. But what you can see there left underneath the suction tube is just a giant crater. That's the edge of where the ear canal was. It's just not there. But to get into that top left portion was really difficult. We had to get to a point where we thought, well, we've done as much as we can safely do now. I had to call it a day there. But got as much as I can do. A lot of this is to do with the ear it is, and it's me being left-handed as well. I have to get, and as I've said before, I'm not a fan of bending tools for bending these tubes for many reasons. Me being left-handed, trying to get in there and then up and then left into the top corner, and then you've got the natural curvature of the ear canal like this, so it's physically impossible a lot of the time. But I've asked them to prescribe her an antibiotic spray for this, and what that will do, those little few bits that are remaining, she was finding it uncomfortable in that top portion as well, so that's another reason why we had to stop. But then antibiotic spray will hopefully loosen the rest of that out as well, and it'll just fall out. That could have been a piece of dead bone as well, that, by the way. We've just hoovered up there. So yeah, she got craters on the left, the right.
Is that how long ago she was?
We're developing one on the base there as well. So the whole thing is just crumbling apart, unfortunately. The other one had another crater, but it was much deeper in the ear as well. It was almost going behind the eardrum. It was a really odd one. You don't often see craters in the ear like you will in this one as well. Now this one, you might see it's slightly more at a different angle. You see it's more sloping to the left. Now at this point, the patient decided she needed to change positions to make herself more comfortable before she was just sitting upright. But for this one, because obviously she was in the chair for quite a long time, she she just decided she wanted to lay her head down on the chair and be more. It wasn't flat completely, but we had to recline the chair to like 45 degrees. And that means I've got to come at it from a whole different angle, which is tricky. Tricky anyway, but when you're working at an angle with someone's head that they're not normally in, you've kind of got to do things differently. When you do anything differently that you don't do often, it becomes a little bit more difficult. So that's why I was having trouble angling the endoscope over the top of the cartilage portion there. So you will see a bit of blurring in the bottom left, but I'm sure you can see enough. And had a lot of trouble with this one. It was quite a solid chunk. Not as much ear soup in this one, but certainly found quite a nasty crater in this one. So if I do hear any updates, I will let you know. A lot of people do ask me, and I still get messages on videos that are like a year or 3 years old saying, did you get an update after you referred these people to the ENT specialists? And I'll be honest, the answer is almost always no. I mean, they're very busy people. I appreciate that. I do ask every single patient who comes to please let me know the result of something, and I want to make sure they're okay, but I want to make sure that they interested to know if I was right and what my suspicions were, what these things were that I was referring them for. You begin to see the extent of this problem as well in a minute when this comes out. Look at the thick skin on the left-hand side of that. So again, already I'm suspecting we're going to find similar things in this ear that we did in the first one. Couldn't quite get a grip with that with the hook. I did try coming at it from the underside. Soon you see a flinch then. As soon as I lifted that up, the patient flinched a little bit. I'm not sure whether it was just the sensation of this thing being lifted up in the ear canal, or she didn't say it was uncomfortable. She just noticed me doing something. So again, you can see there is a fair amount of soggy skin underneath. And it did need a really good shake, rattle and roll to get this thing out. But stay tuned to the end, because the last little crater is it's not where you'd expect it. It was a fascinating case. And I know a lot of you like the longer ones that there's a bit more to. So do I. I don't necessarily enjoy doing them. It would be nice if there were slightly less complicated ones. I'm getting more and more complicated ones walking in through the door. So we decided to go to the forceps, as you can see here. And thankfully, out it popped in a humongous chunk of pretty much exclusively dead skin with an extremely soft, soggy, mushy layer underneath it. Look at that. I think I slowed that down as well. I was that impressed with that as well. And here it is on the paper, not next to a ruler, but it was about 2 centimetres long, almost the entire length of the ear canal. Now it's a bit foggy and a bit misty. I think I needed to go and clean the endoscope after I took that out. But it's in that bottom right corner there that I'm instantly suspicious about. I mean, the fact that you got warmth in here as well often suggests infection, and this wet, soggy, dead skin as well. So possibly something going on in here as well that shouldn't be. But I just wanted to investigate all this area here to see what's going on. Now, this is extremely deep in the ear. This is just in front of the eardrum, as I was explaining to you before. And as I lifted these things up, I thought it was more serious than I thought it was going to be. When I first did, an extremely difficult part to get to as well. But I was happy with what we did on this one. Do get, if you, some people ask me, do I get nervous, or do you worry about doing something like this? I think you'd be doing something wrong if you didn't get nervous about stuff like this, to be honest with you. Because you can see just how close that is to the eardrum, can't you? We're talking fractions of a millimetre away from it. And it's not that common to get these depressions and cavities down here in the ear. Does that mean there's something else going on? Again, I don't entirely know. Possibly, but that's for the specialist to determine. And you can just see this thing, this skin trying to work its way out of this crater here. Again, really difficult area to not just get into but visualise as well with the endoscope. But I found the right angle. Obviously all done with the small tube here, the fine-in tube. But I was very aware that the patient was a little twitchy, but the longer the procedure went on, obviously the more relaxed she was. I was worried that she might nod off at some point because at this point she was, like I said, she was semi-recumbent. She was lying at 45 degrees and she was shutting her eyes. She didn't want to watch it on the screen. People who brought her were fascinated watching it on the screen. I think it was a family. But I don't want them to nod off and then all of a sudden wake up and go, what's going on? You know what I mean? So I did have to keep talking to her just to make sure she didn't fall asleep. I am prone to the odd little dad nod, as the kids call it, usually when I'm watching a film. People have fallen asleep while having this done before, especially if it's lasting a long time. But I'm very mindful of that and try and prevent it from happening if I can. I'm all for getting people relaxed, but not that relaxed. I think we're pretty much approaching the end. I tried to have a go at that little soggy bit on the right hand side. I don't know what's underneath there, if anything, but we've certainly revealed another little trench down there. So yeah, very interesting ears. I will give you all an update if I get one, but as I said, it's very rare that I do. But I have asked the family to ring me and let me know, just to make sure that she's okay. I suspect they'll probably manage this conservatively, to be honest with you. They might just manage it with some antibiotic spray and insist that she comes to see myself every few months just to keep a close eye on it. Anyway, I hope you enjoyed that and found it interesting. But for now, take care of yourself and I'll see you soon. Ta-da.